Hello, my name is Shannon Herrick, and I'm a PhD candidate in kinesiology at McGill University under the supervision of Dr. Lindsay Duncan. Today, I will be presenting the creation of safer spaces for LGBTQ plus physical activity participation. First of all, I'd like to thank my supervisor, as well as my undergraduate research assistant, Tyler Baum, for all of their assistance with this study. Now, a bit of background. With my research, I'm very much interested in how sexual orientation and gender identity influence a variety of experiences in and across physical activity contexts. Because of this, I work primarily with LGBTQ plus communities. This is an umbrella term and an abbreviated acronym that stands for lesbian, gay, bisexual, transgender, and queer identified individuals. Now, across public health literature, it has been shown that LGBTQ plus communities experience disproportionate rates of chronic diseases and health concerns such as diabetes and cardiovascular disease, etc. And the bulk of these can actually be mitigated and prevented through regular participation in physical activity. Now, unfortunately, LGBTQ plus communities also experience unique challenges to and barriers to physical activity participation, such as homophobia and transphobia, so much so that certain subgroups of LGBTQ plus communities have also been shown to have lower rates of physical activity participation when compared to their heterosexual counterparts. So the question guiding this particular study was, how can physical activity contexts be made more inclusive of LGBTQ plus participation? In order to answer this question, within the creation of a multi-component online survey, we actually engaged in a series of focus groups with LGBTQ plus adults. Throughout these focus groups, we refined and created specific questions to be incorporated into the survey, of which were 7 open response questions. Now, this entire survey was circulated for 6 months, hosted on Qualtrics, and all recruitment was done online through snowball sampling. Participants, in order to be eligible, had to self-identify as LGBTQ plus, be 18 years or older, understand written English, as well as have access to the internet. Now, I'm just going to be focusing on the parts of this multi-component survey that were taken into account for this particular study. So we only looked at the responses to one of the 7 open-ended response questions. This open response question was, for this study, in what ways do you think physical activity could be altered to be more inclusive of LGBTQ plus participation? We also took into account a host of demographic information such as sexuality and gender identity. Now, we had 766 participants submit textual responses to that open-ended question, of which 58 submitted a preset response, which was physical activity cannot be made inclusive. Now, this preset response was negotiated and prompted when the creation was brought up in the focus groups. Now, out of the 766 that submitted textual responses, 72% or 558 participants provided specific suggestions that outlined how to create safer spaces within physical activity contexts for LGBTQ plus participation. Now, of our participants, it's important to note that the majority identified as cis women, majority also identified as lesbian, gay, or queer, and the sample is predominantly white at around 65%. Now, for the analysis of the textual responses, we engaged in a conventional qualitative content analysis where we inductively created the coding categories. Responses were then coded. We also tallied the response frequency per code. It was reviewed quite rigorously, and we also engaged in critical peer discussions with Lindsay acting as our critical peer. Now, for the results, I'm going to be presenting them in the order of descending response frequency. First of which, we had a lot of suggestions outlining the membership of these physical activity spaces. Then we had suggestions that detailed informative signage, anti-discrimination policies, inclusivity training, and lastly, diversity. Now, under the suggestions that really detailed the membership or who the spaces were for, we have 3 different variations of these responses. The first of which we coded as concessions, where LGBTQ plus positive or inclusive gyms should be created. So these are just pre-existing spaces that were encouraged to be more LGBTQ plus friendly. Then we had alterations. Now, these were suggestions that detailed either LGBTQ plus specific classes and or times, as well as, lastly, we had creation of new spaces, such as the creation of LGBT exclusive gyms. So across these suggestions for membership, we have them ranging in terms of LGBTQ plus exclusivity for the sake of inclusivity. Next, we had a variety of suggestions for informative signage in order to clearly demark the spaces that are actually inclusive of LGBTQ plus participation. And this normally relied on frequently used iconography, such as the pride flag or the safe space triangle. Then we also had suggestions for not only the creation, but specifically the advertisement, as well as the enforcement of anti-discrimination and harassment policies in order to help maintain safe spaces within physical activity contexts. Then we also had some suggestions for inclusivity training for all staff members in order to better support LGBTQ plus patrons. We also had, lastly, some suggestions for increased diversity, specifically calling for more LGBTQ plus staff members across physical activity spaces in order for people to feel more at ease within those settings. So quickly into some discussion. Now, the suggestions for membership definitely highlights a nuanced and tenuous relationship between exclusivity and inclusivity when we're engaging in suggestions in order to increase inclusivity across a variety of contexts, as well as the majority of participants actually advocated for relatively inexpensive changes to physical activity spaces. And a lot of the responses really show the personal and community connection to prominent displays of iconography such as pride flags in order to really signify a safe space to engage in. So some conclusions. So the findings present a myriad of practical suggestions for increasing LGBTQ plus inclusivity that could and should be adopted across physical activity contexts. However, it is also important to note that the majority of participants used hypotheticals as well as the future tense, which indicates that despite the feasibility of these suggestions, they are not that widely spread and there's still a lot more work that needs to be done. Thank you so much for your time.